Michael Seals, professional boxer. It started before my last fight. It was agonizing pain all day, every day. I've never let up.
This guy is an absolute warrior. He fought for the light heavyweight championship of the world, and he had neck injuries that were basically preventing his left tricep from working.
I couldn't do a push-up without face planting. I couldn't throw a double jab.
And wasn't able to use his tricep for his jab.
There was no escaping it. I was going to need surgery. It was just detrimental to my career.
This is a patient that has bilateral foraminal stenosis at 2 levels in the cervical spine.
It was pressing down on a nerve, and it wasn't my arm wasn't getting the signal.
Actually had some weakness in the triceps muscle.
My punches were slower. I couldn't double a jab. I couldn't throw 2 jabs at one time.
So what I'm going to do is put him prone on his tummy and decompress really 4 nerves, 2 on each side.
Looking forward to it, man. I know I'm in good hands.
Try to get his strength back and get the shooting pain out of his arm.
Looking forward to getting back to fighting and winning the world title.
Hopefully we can get this done, and he's going to have good results, and I think it'll probably take somewhere in the 2.5 to 3 hour range. So here we go.
Once we got the MRI back, Doc said it was C4, C5, C6. They were pressing down on my nerves, going to my hands. I think that's the most pain I've ever been in, consistently. And my threshold for pain is very high. Going into the spinal surgery, I actually felt great because I had confidence in Dr. Linville, had confidence in the team at Barbour. They gave me all the information I needed. It kind of gave me a sense of security, and I actually was looking forward to it. The surgeries are seamless, and you come back, the recovery is it's flawless.
Dr. Linville performed an operation on him and resolved that problem, and he did great.
I can feel that it's freed up.
It's not hurting here. I don't mind just starting to do some bag work or hand work, whatever. But again, I don't want you any chance of you getting hit. So you're pain-free, full range of motion.
I'll listen this time.
That's right.
I don't want anything messing this up.
Man, feel good.
Take it a day at a time, and I want nothing but success for you.
Barbour Orthopaedics, it's family. It's the best I've ever been treated.
So how long since your surgery?
It's been a little over 12 months. The recovery was so quick. Man, I feel like a new man.
You happy you had it?
I am ecstatic. I feel like I should have had it a couple years earlier. I feel great. No pain. It's 0 pain. I feel reborn almost. I feel like a completely different fighter. I had confidence in Dr. Linville. Had confidence in the team at Barbour.
Get the best fighter in the world, the best spine surgeon in the world.
Yeah.
So excited for this.
Sky's the limit for you, man. Your strength's good. Everything looks great. The result, I think, is fantastic.
My coach was like, your left hand is starting to feel like a right hand again, because he always said I had 2 right hands.
You did awesome with one hand. I can't imagine what it's going to be with 2.
I know. I wouldn't want to be on the other side of that hand.
Don't mess with this guy when he's got 2 hands going.
I know. It's my pleasure and honor to take care of you, so I'm just glad to see a good result.
I'm thankful to God that He put me in your path.
You're going to do awesome, man.
Yeah, man.
No question.
I've now operated on Michael's knee several times, and he really just has an arthritic knee, but this guy is just such a savage and such a warrior that he's able to fight through it.
He's just such a tough guy. Dr. Linville did neck surgery on him. His left arm didn't work, and he still almost was light heavyweight champion of the world.
I went in and cleaned up the knee to the best of my ability.
That's if me can. I mean, his knee is destroyed.
But this guy is just such a savage and such a warrior that he's able to fight through it.
It's like knee replacement is not me telling the patient, it's the patient telling me.
I went in and cleaned up the knee to the best of my ability. We're going to let him recover. Knowing this guy, I know he's going to be back in the ring fighting. If this doesn't work, our next stop is going to be a knee replacement, and I would normally say that would eliminate somebody's professional fighting career, but not in his case. If we end up going that route, I wouldn't put it past him that he'd still won a championship. His knee has really been degenerating over the last several years. I think we've operated on it probably 3 or 4 times, and it's just gotten to the point where it's just bone on bone, and he can't function with that knee, but he's still got a lot to offer in the ring, and so he and I talked about it. All right, we're getting ready to go do the total knee replacement on professional boxer Michael Seals. So when I first started my training, the idea that we would do a knee replacement on a professional athlete and expect that athlete to get back to competition was out of the question. But nowadays, the implants are so robust, they last so long, they're so strong that I think he has a chance. And because of Michael Seals and who he is and his mental state of mind, I actually think he may be able to get back into the ring and be competitive.
I'm a warrior, so it comes with it.
So let's go in and get this knee replacement done, and I'm really excited to see if he can get back and become world champion again. Let's go in and take a look. Let's do it. His knee is just so arthritic now, he just can't really bend it, he can't use it. So he and I talked about it, and when I take everything into consideration and just knowing who he is and just how strong he is and tough he is and just how bad his knee is, I mean, he was competing at a high level with a knee that barely bent and that was just bone on bone. I actually think this will give him a better chance than with the knee that he had. If anybody can do it, it's him.
You give me a little time, and I can do anything. That's how I feel.
Straighten out the knee.
Thank you.
You guys are doing great. So we got to move these osteophytes. Loving it. He's got just a ton of scar tissue up here in the suprapatellar pouch, which affects his range of motion. So we want to free some of this tissue up so he gets his normal excursion. Okay, excellent. We're going to take a little more off the front, restore his mechanical axis, helping us center the native tibia. Absolutely perfect. He's going to like this knee a lot better than the one he had, that's for sure. Wow, look at the size of this guy. Think that causes pain in the knee floating around in there? This guy fought for the light heavyweight championship of the world with that guy. That was just one of them. My gosh. Michael Seals just made differently. Look at this. Hello. How does a guy fight professionally with these marbles in his knee? Look at this. Let me show him. Another one. The first time I scoped his knee, I didn't really know him. I took him to the OR twice and I removed, I don't even know how many loose bodies there were, about as big as those 3 that we just took out. I mean, he had bowling balls in there. It's perfect. Gun, straighten the knee. Okay, slowly. Good. Total perfection. That fight he had for the light heavyweight championship, I thought he was doing really well, maybe even winning. He also had some arthritis in his neck, so his left arm wasn't working his jab. So he basically went into that fight with no jab. I mean, competed and could have won, and he had this knee. He is just made differently, this guy. That's why I feel like we get that in there, that'll be just enough for him, because Linville already operated on his spine, and he's got his power back in the left, so see what happens. We elected to proceed with a total knee replacement, and it was a really tough case. He had a lot of scar tissue, a lot of contractures. He had a lot of wear on the bone that made it difficult to correct his mechanical axis. That couldn't have gone any better.
All right.
We were able to get a fantastic result. We got an excellent knee in him with great range of motion. Start using it immediately.
Okay.
We're going to bring him over to our recovery suites now, and he'll probably go home later on today. All right, man. I got to go to the next one. I'll check on you later.
Okay.
Yeah.
When I was in the ring, like every move I made, I had to process the move before I actually did it. Every move, like constant pain. Think about the guy hitting me. Think about the punch I was going to throw. Really, I'm looking forward to this bounce back. I'm going to win a world title with a knee replacement.
Make it happen.
Yeah, anything better than what I was dealing with. People are in trouble, bro. Barbour Orthopaedics is family. I'm not just saying it, it actually feels like a family.
He's had multiple knee surgeries over the years, and eventually he developed post-traumatic arthritis of his knee, and it just wasn't functioning anymore.
Anything better than what I had, and like 20% better than what I had, I'm knocking people's heads off, bro. Yeah. I'm glad I got you guys.
That's right.
Just keep me running.
Yep.
Yeah.
Running, man.
We'll do our part.
All right, man. I want to see some results.
Oh yeah, you're gonna see them.
It's all in the results. It's
All in the results, man.
It's all good.
Yeah,
man.
yeah. I recommend Barbour Orthopaedics over everyone else.
We are Barbour, and this is the Barbour Way.